Now we will hear from Dr. Brook Harmon, who is an associate professor in nutrition and foods at Appalachian State University. She holds a BS in human nutrition and MS in exercise science, PhD in health promotion, education, and behavior, and completed a postdoctoral fellowship in cancer epidemiology. She, in addition to all that, is a registered dietitian and holds a certificate in gerontology. Much of Dr. Harmon's research much of Dr. Harmon's research partners with faith-based organizations to assess their health needs and develop health promotion programs aligned with identified needs, as well as research on ways to promote and enhance wellness among clergy. To get things started, I will simply say, welcome. We look forward to your presentation.
I am going to start us off talking about today's topic of clergy self-care and how we measure it and how it relates to overall health. One of the pieces that I have to start off with is the fact that while Nate and I, along with Travis and Karen, are the ones presenting today, this is part of a multidisciplinary team's effort. So this is the larger group here. And we have kind of come together around a singular mission in which we're really focused on conducting research that helps us understand and address health-related outcomes among faith leaders. And I just wanted to give a little background of kind of how the research that Nate's going to talk about today and our group came to be. In that weird time of 2020, I got an invitation to be part of an online journal club hosted by the International Association of Human Caring. And at that journal club, John Nelson, who's pictured here and who's one of our team members, was presenting on data that he had been doing, looking at this idea of caring for self and a particular survey called the Caring Factor Survey, Caring for Self. And he was looking at it with nurses, and he was looking at patient outcomes, but he was also talking about some health-related outcomes that they had learned about nurses. And this caring for self comes from this theory of Joan Watson, who's in the nursing field, and it has 10 caritas, and they cover physical health and spiritual health and mental health and social health. And I just was like, man, I really feel like this is applicable to clergy and the work that I've been doing with congregations and then clergy specifically. So Nate and I met with John, and we've started working on this, understanding this kind of continuum of kind of clergy and their caring for themselves, how this might be related to engagement and self-care behaviors, and then how that could be ultimately associated with health outcomes. And so as we started this work and started these connections and our team kept building, we wanted to really make sure we were grounded in what other work had been done in the clergy kind of self-care realm. And so we started by saying, well, we need to look at the literature and we need to understand what other people have done before us. And so that started us on this pathway for this literature review and really shaped our two main questions of how does the literature define self-care within the context of faith leaders? And then what research exists examining self-care behaviors within the context of obesity and obesity-related chronic disease outcomes. And at the time when we started this work, it was 2020, 2021. Most of the work at that time had been in this realm of obesity and obesity-related chronic disease. I'll talk a little bit at the end about how we've seen the literature shift and kind of some of our new work that we're doing. But this is where we felt like the literature was most robust at the time. And so this is where we started. We then had to make a decision, are we doing a meta-analysis? Are we doing a systematic review? Or are we doing a scoping review? So all of these are ways that, researchers look at the literature that's out there. And we didn't want to confine ourselves to just looking at survey studies or quantitative studies or intervention studies. We really wanted to be able to pull in reports from different denominations and other gray literature. We also wanted to be able to pull in qualitative work. So that's why we decided on a scoping review, because that really allowed us to look at the breadth of the literature that's out there. And we really wanted to make sure that we had a really comprehensive view of kind of clergy self-care and how people were defining self-care. And then we also didn't want to confine ourselves to just kind of Christian denominations and Christian leaders. We did want to see if we could learn from research that had been done with other faith leaders across different religions. And so we expanded our literature search to all faith leaders.
All right. So as you prepare to go out into the breakout groups, we were hoping you would consider the following questions. Caring for self versus self-care, are they the same? Are they different? And how does self-care among clergy differ or not from self-care in society? And so again, self-care versus caring for self, same, different, or perhaps there's another word that resonates better with you. And how does self-care among clergy differ or not from the self-care in society? So hopefully that will be good conversation for y'all in their breakout rooms. And now I'd like to introduce you to Dr. Nate West. Dr. West received his PhD in public health with a concentration in social and behavioral sciences from the University of Memphis School of Public Health. He's currently a research assistant professor at the University of Alaska Anchorage, and he is a community engaged researcher with interest in health promotion and obesity chronic disease prevention, particularly within faith communities. Dr. West is working to partner with Alaskan faith communities to better understand the health needs of churches as well as their faith leaders. So Nate, I'll let you take it from here.
Hi, everyone. Nice to be speaking with you all today. It's a nice crisp day in Alaska. We've got about 5-6 feet of snow still on the ground, so I'm excited to be in a nice warm house talking about this work with you all. So as Dr. Harmon mentioned, we did the scoping review. It took a few years, but it was something that we were really excited to do, and we learned so much through it. And like I said, I'm very, very thankful and excited to talk about this with you all today. And so what did we do? So we utilized in our scoping review framework, we used Arksey and O'Malley's framework, and as well as the updated recommendations from Dott and colleagues. And so what is that? The scoping review essentially allowed us to use a widely used framework or frameworks to have a flexible research agenda as well as questions. And so what did we do through this? Through this framework, we defined our research questions. We identified the relevant studies to assess. We then selected those studies to assess. We then charted the data from these studies that we'll talk about in a minute. Then we summarized it all. And then I think the most important piece of this work is the group consultation aspect, which I will talk about here in a minute. But the group consultation allowed us to then not only, it wasn't a silo, right, where it wasn't just me or it wasn't just Dr. Harmon with the studies. It was a two group of reviewers, and then we brought it to the whole group, as Dr. Harmon just mentioned, to have that multidisciplinary perspective on what to assess and what to analyze overall at the end of the study. And so studies were identified through database searches, so large database academic article searches, so PubMed, CNOL. Backward searches were used through study references. So when we'd go through a more well-known study of clergy health, we would look at their citations or references and see, okay, well, does this study apply to what we're doing? And we found some articles through that. And we also used gray literature. As Dr. Harmon mentioned, the scoping review allowed us some flexibility to look at reports, dissertations, which contained valuable information and a knowledge of clergy health, which we were able to assess through this work. So what did we do when we looked at all these? What did we look for? Well, we looked for self-care behaviors, and you might be saying, okay, well, self-care is a wide definition. Well, we casted a wide net with our definition, and we didn't just look at physical activity and diet. Now, those were important, but we also looked at rest, managing demands. We also looked at other aspects of what could be defined within self-care, along with the more popular ones that were found in the literature. And we also looked at obesity and obesity-related chronic diseases, such as cancer, heart disease, diabetes, high cholesterol, high blood pressure, common ones found within the clergy health literature. And so we use these terms to find relevant studies and then selected those relevant studies to assess. So those are our data sources. And so this is a breakdown of kind of everything that we did. It's a nice flow chart. So we identified 418 studies. from the database searches. We identified 18 from backward literature searches, 10 from gray literature searches. So as a reminder, the backward literature searches were from the articles that were more well-known or from the Clergy Health. We looked at their references and citations. And the gray literature searches were the dissertation and reports and other articles that may not have been found within other citations or from the database searches. And then we removed some duplicates, and then the articles that were eligible, we excluded 373 because they didn't mention clergy or faith leader. They mentioned they were not adult, not English, didn't mention self-care behaviors, not obesity or chronic disease related. And then finally, we had studies included in review. And before, just to mention, the group consultation aspect was so important because there were more than 20 when we ended. But the group consultation allowed us to walk through each study with our group and talk about the relevance. And so we ended with 20. And so it allowed us a more rigorous analysis of what we thought would kind of give a good picture of kind of the clergy health and self-care of obesity-related chronic diseases in that context. And so that was one of the most important pieces to this work. And so, okay, here's what we did. We did the data sources, we did the flow chart, but now what did we do with the extraction and synthesis? And so we reported the author, the year published, the study aim, the study design methods, the sample size and population, different self-care definition and behavior, and then the primary findings. And so there's a lot to go through, but to help us rigorously not only look and identify relevant studies, but to also provide the findings in narrative format, we used the Braun and Clark's thematic analysis framework, which essentially allowed us 6 steps to become more familiar with the data, develop initial codes from the charted data that we identified. We searched for common themes or patterns. We then assessed those themes and then named them, and then we reported the findings. So it was a process throughout. We didn't just kind of do it all at once. So it allowed us step by step, again, working with our group to provide feedback, provide different multidisciplinary perspectives to assess that. And then what we charted was the self-care definition. So how articles define self-care, or did they? Associations between self-care behaviors and obesity-related outcomes, and then self-care as a dependent variable. So those looking at how obesity-related behaviors might, or obesity-related factors might influence obesity-related behaviors, such as barriers, such as surrendering to an illness might influence their physical activity or diet management, diabetes management, and so on. So what did we do? And here's what we found. So we had 20 studies that met eligibility criteria. 15 were quantitative, so numerical data. 12 were cross-sectional, meaning there was a snapshot in time. And then 13 were not informed by behavior change theory. And so this was something that we decided as a group was important to discuss, because behavior change theory essentially provides us a roadmap of understanding certain behaviors or certain findings or problems. And so theory provides a roadmap, as well as when studying problems or designing studies. And so it's important to see what was done, and was there something to guide the analysis or guide the study when developing it. And the literature does suggest that studies are more effective when applying or using behavior change theory. And so we thought that would be an important variable to assess here and report. And so faith traditions examined. So we had 15 that were identified as a Christian denomination, 15 within Buddhist, and then most studies, 12 of the studies were had assessed or looked at white Christian men. And so that was kind of the most important or most overall finding that we found within the Christian denomination of the studies that we looked at. And so our thematic analysis, we found that there was no consistent definition of self-care. 17 of the studies had no mention of self-care, but instead looked at self-care and more of the variables that we assess. So physical activity, diet, sleep, rest, taking a Sabbath, other things like that. So that's how they had looked at self-care. And the most common self-care behaviors examined, which Dr. Harmon briefly discussed, and kind of looking at the past however many years of the clergy health literature, physical activity and diet were most commonly examined. And so within diet, though, was interesting. Vegetarian diets were mostly looked at. And so there was one meat study that looked at meat and fat intake, but most of the other diet studies looked at vegetarian. And those that looked at physical activity and diets saw inverse associations with obesity-related outcomes. So more physical activity, less likely to have an obesity-related outcome, essentially. And then other self-care behaviors with inverse associations. There are only 2 of these studies. So taking days off, sabbaticals, rest, and sleep. So taking days off, going back to the studies looking at essentially what the authors looked at, taking days off was, do you take a day off per week? That's how that was measured. Sabbatical, the question was, have you taken a sabbatical in the last 10 years? And then rest that could be almost synonymous with some of these. And so we can talk about that later. But essentially taking days off and sabbaticals, those were how that was examined. So taking days off, do you take 1 day off per week? Sabbaticals is last 10 years, and then rest was looked at through Sabbath. Do you take a Sabbath? Do you take off on the Sabbath? Okay, so what did we do? What did we find? And what do we think is important next steps? So the literature defining the meaning of self-care among faith leaders is sparse, as we just talked about. And most studies focused on a few behaviors only. So physical activity and diet were most of the studies that we assessed. And most studies rarely incorporated behavior change theory, and also used primarily cross-sectional designs, meaning they looked at one snapshot in time and didn't follow over a longitudinal or a long term. And most studies included mostly white male Christian faith leaders, as we just suggested within the literature.
All right, so now as you prepare to go back into your breakout groups, we'd like you to consider the following question to guide your conversation. What aspects of clergy health are you most interested in? What would you like to see perhaps more research being done on? Or are there areas of clergy health that you think that have been studied enough? So those are the questions. Again, what aspects of clergy health are you most interested in? What would you like to see more of? And what would you like to see less of? We look forward to seeing you when we come back together.
So I'm just going to summarize from what Nate kind of talked about and talk about where we see this work going as we kind of continue to work with clergy and continue to kind of see what we can do to kind of influence health outcomes. As Nate alluded to, we saw in the literature so far, it's primarily white male Christian clergy. So how can we recruit more diverse samples? And so really thinking about geography, thinking about gender, thinking about race, ethnicity, thinking about denomination. We were just talking about in our breakout, also thinking about role. Oftentimes the research is senior clergy, but do we need to be branching our work out to be looking at the support circles around them? We have some studies with the United Methodist Church that have looked at clergy or have recruited clergy and followed them over time, but these are a pretty small number of studies. So more work that's not just a snapshot, but actually following clergy over time to really get a sense of how things like self-care, caring for self, behaviors, health outcomes, how those evolve over time. One of the things that really intrigued our group was the other behaviors that came up. There were only 2 studies, but we are seeing a lot more work in this area around taking time off, being able to set those boundaries with congregations, with family, with communities, to be able to take that time away, whether that be a day off or something more substantial like a sabbatical. But what other self-care behaviors beyond just diet, physical activity, and sleep do we need to be looking at in order to really think about health holistically? And then the last one is more kind of thinking about programs in addition to not just studies, but also the programs that we design for clergy. And how can we make sure that we're using behavior change theory? So Some of the behavior change theory out there really focuses on the individual. So thinking like health belief model, in which people kind of have to assess like how susceptible they think they are to a condition, how severe they think it will be, and then whether or not that kind of motivates them to change behaviors. But one of the things that we know and are seeing a lot more in the literature with clergy is really acknowledging that clergy are part of this larger whole. And so theories like the socio-ecological model, which say we are nested within, kind of social circles and are nested within organizations and policies and things like that. There's also one called the social cognitive theory that also says, our behaviors are determined by us, but they're also determined by the environment around us. And so how can we be thoughtful about individual level factors, but then also these bigger pieces, congregations, families, communities, denominations that clergy are part of, and how can we make sure we're incorporating those and addressing those in programs when we're trying to, engage clergy in self-care behaviors. I saw in the chat, someone said the term kind of being a good steward of ourselves, and I really like that language. So how can we help clergy engage in that stewardships of themselves, and how can we kind of help kind of influence positive health outcomes using these kind of theories that focus on the individual, but also focus on the larger context as well. And just to give a little bit of kind of where we're going with our group's work, I mentioned that, when we started this particular study, this review in 2020, 2021, most of the research had been around obesity and obesity-related chronic disease. There's been a lot more work in faith leaders around mental health. And so we're currently working on a systematic review in which we're looking at what sort of research is out there that's examining self-care behaviors within the context of mental health outcomes. I also mentioned that caring factor survey, Caring for Self, and one of our projects that we were doing alongside this scoping review was to take the survey that John and Gene Watson and others had developed and see if it was reliable and valid among clergy. And so we recruited around 76 clergy who are Protestant denomination or kind of theology, and looked and had them take the caring factor survey, Caring for Self, and were able to establish the reliability and validity of that. And so that actually was just published here in January in Pastoral Psychology. So if anybody's interested in that survey and looking at that paper, I just wanted to put that up here as well. And then we're really committed as a group to making sure that what we're doing doesn't just stay in academic circles. It's real easy being at academic institutions like Nate and I are to publish just in peer-reviewed journals and not get our information out into the hands of those who are serving congregations and then those who are serving and helping clergy. And so we have taken the 10 caritoses that are part of Gene's theory of caring, and we've put them into a context and kind of daily activities that clergy could do to help kind of engage in all 10 aspects of caring for self. And so we have that one. It's called 10 Ways to Fill Your Cup. So if anybody is interested in that particular article, for a personal perspective or sharing it with your clergy networks, feel free to reach out to me. Here's my contact information, Nate's contact information, as well as Karen and Travis's contact information. So reach out, let us know if you have any questions, if you have any thoughts, if you would like the article for your personal use or to share with your clergy networks. And I will end it there and open it up for questions.
All right, so we're going to invite anybody who has any comments or questions. Please feel free to put those in the chat or use your raise hand function that you should have there on your toolbar to see if anybody has anything that they would like to ask at this point in time. So Nate noted that there is not a consistent definition of self-care in the clergy literature. And the question here is there a consistent definition of self-care in the non-clergy literature? And if so, do we know what it is?
Yeah, I'll let Nate talk to this too, but I would say probably not. I think one of the things we found with clergy, in the clergy literature that I think is just a symptomatic of kind of this type of research is we've kind of focused on the behavior. So we focus on physical activity, we focus on diet, we focus on sleep, and we don't necessarily kind of have an overarching, this is what it means when we're saying self-care, which is, I think, also what contributed some of the work of Jean and John and this idea of defining caring for self in the way that they did, because they were kind of seeing it in their work as well, that we're not great at umbrella. We all kind of like our silos, like I do physical activity work or I do diet, and not really thinking about an umbrella definition. But Nate, I'll see if you have additional thoughts on that.
Yeah, I think you answered it well, Brooke. I don't really have much else to add. I think I haven't found a consistent definition, but it was really interesting breaking it down. I think for the past few years we've talked about what does it mean for clergy to engage in self-care, and that's what we were just interested to see, because we always, how Travis, Brooke, and I define self-care is probably way different, and so. But we thought it was interesting, the question, okay, well, we've looked at physical activity, we've looked at diet, we've looked at certain aspects, but we've never really put it all together. And so I think that was a really interesting piece to this work, is that, well, what are people saying? And is there? And if not, how can we continue to look at that? Because I think as we come, I guess my optimism and hope is that as we come closer to maybe somewhat defining, can we consider to learn more about how to assist and help and learn from clergy and their experiences as in their vocation. So that would be my answer.
And one thing I just want to kind of piggyback on to add here, that there's an incredible opportunity that the church has to define this particular area. So what I loved, Brooke, you noted that, one of our participants specifically kind of talked about stewardship, which is a theological term. So what if the church could somehow define for the rest of the academic world what self-care is or should look like? I mean, that would be amazing in terms of a missional contribution, and also just a very practical contribution to the literature as well. Thanks for that.
Yeah, and I saw there's a comment about kind of the National Institute of Mental Health and how they describe self-care. And I think, we have these definitions, but I think where we run into is this operationalization of it. And I think, Thad, what you were saying gets at this a little bit too, is because one of the things that was really interesting to me, and one of the things I think I mentioned this in our kind of continuing the work, is these ideas of sabbatical, taking time off, rest, like those are pieces that are kind of not necessarily unique to clergy, but we're starting to see this kind of conversation around, how do we live well? How do we improve our health? And these sorts of things have never been kind of encompassed until more recently. And so then how do we look at that specific to clergy? Because every occupation is going to be different, but clergy are really unique. And as Thad said too, the church is part of this. And so how do we make this align with the kind of spiritual piece that comes with kind of working in this faith space, that I don't know that we haven't really, I think we're starting to see it, but we haven't really been incorporating that in self-care definitions and operationalizing self-care definitions.
So there are some comments in the chat that I want to make you all aware of. One did include willingness to share the 10 items to fill a cup with everybody. Please, I find that to be helpful. There was another comment in the chat that was a little bit earlier about bivocational ministry, and wondering about is there a difference here, or self-care concerns, or would we find them to be tangibly the same among clergy who are serving as clergy part of the time and maybe doing full-time something else, or anything along those lines? Would it be the same concept of self-care? Would we be thinking about it in the same way? Be interested to know y'all's thoughts on that as well, or if you've seen anything that has examined that yet.
Yeah, and I'll let Nate talk about this a little bit too, and he can share what he's found. What we tend to find when we look at what helps clergy to engage in these kind of self-care behaviors is to be and like I said, some of this is biased because it's been primarily with senior pastors, but being bivocational does make it more difficult to engage in self-care. Being kind of senior pastor of a church that is large enough where there is support in the form of associate pastors and other folks so that you can take sabbatical, you can take time off. That seems to be where kind of the data suggests that, those pastors who are either pastoring to multiple churches plus maybe also have a full-time job, it is more difficult, it seems like, for them to engage around self-care. Although it's interesting, we're doing a study right now in which we're collecting qualitative data because we're trying to get more perspectives from pastors on how do we overcome some of these known barriers around time and being able to, step away from church duties to make time for, taking care of oneself and being a good steward to oneself. And it's interesting. So some of our bivocational pastors that we've talked to, and granted, there's a small number right now, but they are talking about their congregations being more aware of their stress levels, being more aware of their needing to take time away and that sort of thing. I'm not sure if that's a reflection of kind of post-COVID, that we're starting to see some of this kind of churches and congregations being aware of the toll that it takes on their leadership. So it'll be interesting to see how this kind of unfolds in a post-COVID era, and if some of what we're seeing in our qualitative interviews continues as we move forward with those interviews, and if other people see it in their work as well. Nate, did you have anything to add, or Travis?
In terms of bivocational, I can imagine it might add some extra barriers to that. Thinking of what we've seen, Brook, kind of in the studies we've been a part of, talking about this, and it's mentioned in our group, this 24-hour on the go, on the call vocation. I can imagine if you're also bivocational, again, I don't want to speak too much on something I don't know, but also I can imagine taking what we know from full-time, full vocation, being 24/7, and having another job on top of that. I can imagine that'd be an added barrier to the responsibilities of being bivocational clergy, as well as providing and doing something else too. So I can imagine that would impact self-care, but open to suggestions and feedback on that too. So
I know one thing that came up in my small group was this concept of self-care being something else that you just have to do, and another source of pressure, another sense of obligation, another thing that I'm not doing real well, and how ironically it seems self-care can become another way that pastors beat themselves up because they're getting a message that they're not doing it real well. Wondering if y'all have any thoughts on that, and how can we talk about this topic in a way, as a full-time clergy person myself, sometimes I feel that way about it, and I read this stuff and say, yeah, that'd be great, but any thoughts on y'all's behalf about how that we can talk about this in a way that's constructive as opposed to another self-flagellation technique?
Yeah. Well, I would say two things. As a behavior change researcher, that's like what both Nate and I both our grounding is in. And then we have chosen to focus on clergy and work with clergy and faith-based institutions. But, as just behavior change researchers, behavior change is hard. Like, engaging in all of this stuff is hard. If it were easy, like, we wouldn't be talking about stress and mental health and physical health and those being, poor outcomes for the entire nation/world. So I think we all have to cut ourselves some slack. And anytime, I'm doing one-on-one counseling with folks or group work with folks, whether they're clergy or not, part of that conversation is like, we just got to cut ourselves some slack. The second part of it, though, I think is really interesting. And it kind of gets at some of what I was talking about with the behavior change theory is, I think for a really long time, for clergy and then everybody else too, just behavior change in general, we focused on the individual. Like it is the individual who needs to change. The individual needs to increase their physical activity. The individual needs to eat healthier. And what we are realizing it is we don't do it alone. We are so influenced by the people and the structures around us and our access to, things like time off, things like healthy foods, things like green spaces. And so really, I think some of the conversation now around clergy health is not just, hey, clergy, how do we get you involved? But hey, congregations, how do we support clergy and their health? Hey, families of clergy, how do we get you all together and think about health? And so making it, and this is, again, I think it's really important for clergy, but it's also just kind of a wider approach to how we think about behavior change. Is it is not an individual sport, it's team sport, and we have to do a better job of thinking about that team and that support system for clergy in particular here.
I don't know, Nate, if you were to have something to say. I also see we have a couple of hands raised.
Yeah, I was just going to say something really quick. I think I've been thinking a lot about this, and as Brooke mentioned, we're kind of rooted in this behavioral scientists, and I think what I can do a really poor job of is my language around a problem or a topic is just focusing on the problem and just talking about that versus how we frame our language around it, as it's not like coming after someone. It's more like, hey, it's an understanding and framing our language and being aware that, yes, clergy take on many more responsibilities than I can even imagine. And so how do we talk about it in a way that is constructive? And I think as we move past just looking at physical activity and diet and looking at these other variables with sleep and sabbaticals, we'll get a bigger picture and a better understanding of how to continue to frame it. Whereas how do we assist versus come after, or like kind of like, hey, you're doing something wrong, where that's not the case. I mean, just as a personal example, and I don't mind sharing this now, but Rachel, my wife, and I, we adopted a baby boy 3 weeks ago. And I have been the most sedentary in my life over the past 2 weeks. I've been holding a baby for hours on end. So again, it happens, but how do we frame our language and understand there's context that's needed? And so the more we understand and address and get a bigger picture with qualitative interviews and understanding, we could frame our language better so that it's helpful. Anyway, I thought I'd add that in there. So
thank you, Nate. Let's see here. I guess so. As I look at the line of folks, Michaela, I believe you're the one I see there. If you wouldn't, then I see Jeremy as well.
Yeah, thank you. Actually, Brooke mentioned it already a little bit in talking about the communal component. I wonder if anyone is actively asking questions about what kinds of local polity and or denominational polity structures really set us up best for success. And I think there are some structures that are really just unsuitable for well-being. And I wonder if anyone's talking about that, or if there's any appetite for change of these structures to facilitate well-being in a better way.
I think that's a really great point. And it's like, I don't know that we've done any kind of policy analysis to look at, what are these policies? I think some denominations more so than others, track different types of health outcomes, engage clergy in various ways in trying to change behaviors. But I don't know that we have a really good handle on what are the practices at a denominational level that are helpful, and what ones should we be promoting that can really engage. And like I said, not just clergy, but also congregations, because I do think what comes to mind, and when I'm thinking about some of the policies and some of the things that are very clergy focused, not maybe necessarily congregational focused in helping clergy. So I think that is something that we don't know, and it's a really great area to be looking at.
And then I see Jeremy up there with your hand raised.
Yeah. So my aspect, which is perhaps interesting for what you are talking about self-care, is actually how self-care and mutual care is actually very interconnected. Because once my wife told me something which I really take heart is, you know, Jeremy, the best way for you to take care of me is to stay healthy. And I think this is a very good mindset, but you know, but one of the best ways for me to take care of her is not to be a burden in any way for her. So doing my best to be well, as I just talked about in the chat, about the peers self-care model, which talk about the spiritual health, relational health, physical health, intellectual health, and relational health. And just to kind of be sure that as I am intentionally staying healthy in those spheres, I am taking care of the people around me better. And I think this is perhaps the question that we talk in the small group also about how actually should we move another step to move from independency to interdependency, to kind of realize that my self-care can't be done by myself, and we need one another to have a proper self-care. And is there some kind of paradigm shift or some kind of mindset that has to be changed? And how is it right now? Like, are people going towards interdependency and going towards this kind of mindset? Or is our independency preventing us to embrace this interdependency? And actually, if there's some, like, it's just a reflection that I'm putting on the table about how can self-care be more with one another?
That's a really great question and point that you're making, Jeremy. And you know, it's interesting, and I hesitate to say this, but we do see it across several like kind of smaller studies. And we actually saw it a little bit in our caring factor survey kind of validation study. So one of the things we find with clergy is that they are, I don't know how to say this. There is this individual mindset. It is somewhat difficult to get them to do and think about health and community. So getting them to come to group sessions, you know, because they want to be able to trust. They want to be able to open up. They want to be able to feel they can be vulnerable in some of these settings in which we're talking about health and we may be talking about struggles, and that can be difficult. And so one of the programs that we did is because we had noticed and we'd gotten feedback from clergy that, hey, I don't want to be in a health promotion program with my congregation. I don't feel safe. I don't feel comfortable. I want to be able to be vulnerable. I don't know if I can do that in that space. So we created programs where clergy could come with their spouse because that was a place where they felt that was trust and could be in a safe space. And plus they were, you know, if they're both working on it, then they felt supported. But that is one thing where we have struggled and this idea of social health was one of the places where clergy were rating themselves a little lower in the caring factor survey. And so it's not across the board, but there are subsets of clergy who just are struggling with that social health piece. Some of them talk about feeling comfortable and trusting with other clergy, but that is a piece that we have to be thoughtful of and we have to be mindful of, and we have to be kind of in conversation with clergy about is how comfortable are you? Can it be cross-denominational? Does it have to just be clergy in the group? Can it be clergy and spouses? So we've tried a lot of dynamics and we've had lots of conversation, and we're still playing with that aspect of how do you create this kind of community around health that is supporting and feels a safe space for clergy.